Amber and Israel are two people raised on different continents. Their lives are worlds apart in nationality, culture, and experience. They might have never met except for one cause: their desire to help the people who call this isolated mountain community of Bora, Ethiopia, home. Amber is a nurse practitioner. The American native from Chicago is dedicated to improving people's lives and hopefully their social condition with medicine. Israel is a humanitarian. The Ethiopian native from Bora is determined to bring health services to his home village in the southern part of the nation. Their unified vision? To build a medical clinic at the top of the mountain in Bora. Amber and Israel met for the first time in 2009. The chance encounter should not have happened by any account. Amber was about to take a medical team to Uganda when the trip was canceled because of in-country violence. With medical supplies and a team ready to be dispatched, she began looking for another place to go. Dan Clark, who is one of the founders of the Ohio-based Health Gives Hope, had a friend in Ethiopia who knew Israel and the needs in Bora. Amber and her team boarded a plane and went there. For Amber, it was just one more trip, and she anticipated it being her last medical mission trip. She had worked on many medical mission trips and never found the right place to serve long term. She was in Bora for one day, and it was different. I could see Israel's passion, his commitment, and how our visions were aligning without even trying, she said. As soon as I was in Bora, I was in love with the people. We had a fire on top of the mountain and we were singing, she said. It was an overwhelming reassurance that I wanted to do more here. I remember looking around and looking at the people. I knew without a doubt I wanted to come back here. That evening, Amber and Israel stood on top of the mountain in this remote part of southern Ethiopia and talked about the idea of starting a medical clinic. We saw the need and we needed to do it, said Amber. There was never a time or conversation when we thought we shouldn't do it. Israel agrees. As soon as I met Amber, he said, I thought, yes, let's make it happen, and we started the process. With their combined determination, grit, and courage, Amber and Israel transformed their vision into reality. In 2011, Health Gives Hope began construction on a gray, rectangular-shaped building for the clinic. Amber is the organization's medical coordinator, and Israel is the nonprofit's country coordinator. When I stop and tell someone what we're doing, their reaction makes me think, wow, we're actually doing it, says Amber. It blows me away of what we've done and how far we've come so quickly. And we're just getting started. The clinic in Bora is part of the journey 32-year-old Amber has planned to take for years. As a college student, she took a medical mission trip to India, and the experience solidified her desire to work in international healthcare. She became a nurse practitioner after receiving her master's degree in nursing from the University of Massachusetts. She is currently studying for a second master's degree in global health from the University of London. 30-year-old Israel, who studied music at the Addis Ababa University and who lives in the capital city of Ethiopia, remembers a childhood of poverty in his remote village of Bora. When I grew up, I had nothing, he says, recalling a time when a man gave him money to get a ride home from school. That moment was life-saving. That 25 cents let me go back home. It felt like $1 million. With the support of Health Gives Hope, Amber and Israel oversaw the construction of the Hidota Health Clinic, which served its first patients in the newly constructed building in November 2013. The clinic requires ongoing donations to maintain its mission. Some people feel that if they can't donate $1,000, why donate 20, says Amber. Those donations, no matter how big or small, do make a difference, and they impact people and change people's lives. Every little piece matters. Recalling his childhood and the generosity of strangers, Israel says what other people may deem as a donation too small to matter might be significant for someone else. What we do right now might seem like something little, but can make a big difference in their lives, he says. Twice a year, in April and November, Amber and Israel take volunteer medical teams to Bora. The vision we have for teams from the United States is to bring education and to meet the needs that we see in the community, says Amber. The people's needs include dental and eye care. Some patients complain of having had a toothache for years. Others say they cannot see at night. Village leaders played an active role in bringing the clinic to Bora, which was part of Israel and Amber's vision. They are adamant that the cultural authenticity remains intact in Bora. At the onset, they met with village elders to ask about the community's greatest needs. Amber said the then chief and Israel's uncle told them that women and children are dying in childbirth, which prompted the medical clinic's focus on maternity and pediatric care. We all work together to make sure the culture stays as it is, says Amber. We want to help, but leave them as they are. During a recent visit in Bora, village elders greeted Amber with warmth. The women held her at arm's length, taking in the details of her face before pulling her into a hug. Laughter, smiles, touches, and hugs. No translator was needed to convey the joy of the welcome. Amber's done a wonderful job of being deliberate in her approach and building the right relationships and being accepted to the community, says Jillian Phipps, a pediatric nurse practitioner from Florida. It's as if she's a member of their family. Israel and Amber educate visiting teams of volunteers about cultural customs and practices before they enter the village. For example, volunteers are asked not to give money or gifts to individual people. Instead, the gifts they bring are stored in a room in the clinic and are dispersed by the village leaders after the team leaves the community. Israel explains why. Culturally, people are hospitable and kind, and we want to maintain that by not instilling expectations. The ongoing generation is the one affected, and they start forgetting their authentic culture. We have this beautiful culture that has been here for centuries, and we want to preserve that. For VoiceBox Media, I'm Holly Weiss.